Hey everyone, welcome. We're so excited to have you here for this chat about non-medical pain relief options for labor with a group of our certified doulas. I would love in the chat if you just pop in where you're tuning in from and how you heard about our chat today. I'm also recording this, so if you want to share it with a friend or a family member who is expecting or you think it would be useful, I will make sure that everyone who's signed up gets an email with the replay link. We'll go ahead and jump right in just to be mindful of everybody's time. I appreciate you taking the time in the middle of your day over your lunch hour to join us for this conversation a little bit later if you're on the East Coast. But I'm going to start with, I'm just going to go clockwise with Heidi, how you introduce yourself and tell us a little bit about your work.
Hey guys, so I'm Heidi and I am in Charlotte, North Carolina. I've been a birth doula. This is my 20th year. And I thank you, Lydia. I host the Birth Story podcast. So for anyone who listens to podcasts, that is my podcast that you hear my voice on every week. I also have a book, the Birth Story Pregnancy Guidebook and Journal, that I wrote with the director of obstetrics from Chapel Hill. Oh, thank you, Amelia. There it is. Um, I have a work partner, Colin Parsons, that together we support 100 private doula clients per year in Charlotte, North Carolina. We run the only pregnancy concierge. So we see our clients through often their fertility journey, through the entire pregnancy and into the postpartum period. So I'm happy to be here. Thanks, Amelia.
I love that so much. Yes, thank you for joining us. All right, Lydia Carly, your turn.
Hi, my name is Lydia Carly. I am a doula here in the San Francisco Bay Area. I'm also a neuromuscular massage therapist and health educator, and I have been a perinatal massage therapist for 10 years and a doula for 5. And I serve what they call like the peninsula, which is sort of like around San Francisco south and south into San Jose as well. And my approach to body or birth work is centering my client in their story. We love babies, but if parents or mothers are not held, then they can't hold their children. So that is my approach to body work and
Beautiful.
to doula work. Yeah.
Yeah, thank you so much. All right, Asia.
Hi, I'm Aisha Reichard, and I am a birth and postpartum doula. I am based in Orange County, California, but support clients from Los Angeles down to San Diego, and really just come to my clients with evidence-based information, helping them have the information that they need to make the empowered decisions around their pregnancy, their birth, and their postpartum experience, and making sure that they have all the resources around the clock to make sure that they have a really supported chapter during this season of their life.
Beautiful. I love that. And as a quick introduction to myself, I'm Amelia Protova. I'm head of community here at Anja and the moderator of this chat. I'm also a certified doula for around 7 years. And I'm just like really thrilled to have this conversation today. I know it's going to be really helpful and hopefully empowering on your journey through your pregnancy as you plan for your birth and for, coping with birth and all of the pain relief options that you have from a holistic point of view. So I'm going to start the chat off. We can follow a similar thing, but feel free to popcorn around. Let's talk about the most common non-medical pain relief options that we see being utilized successfully in spaces of labor and birth. And I would also say the immediate postpartum as well.
I'll start since we're going in order. I will say I made a list of like probably 50 things. And so to not capitalize the conversation, I'll just pick like 5 and then we'll let each one of us share a couple of the things because I'm sure our lists look pretty similar.
Right.
I'll just go with the first couple of things that are on my list. Water, hydrotherapy, so baths, tubs, spas, showers. Tiger balm. Some people use like icy hot or a CBD oil with like a menthol or eucalyptus. I happen to use tiger balm. So something that's just kind of like cooling and hot for the skin. A TENS unit. That borders for me on non-medical, but I would still put that
Yeah.
non-medical. And then a heating pad.
I will jump off from there. Heat tends to be like one of the first things that comes to mind for me. And I think it's more about creating either a contrasting sensation or a comforting sensation for my client. And to piggyback on the TENS unit, as a massage therapist, I use a lot of touch. So like acupressure is another method. Even if you're not someone who is licensed to touch, learning acupressure for labor support and postpartum is really great. And then I'm to continue on this sort of like sensory band like wagon that I'm on, aromatherapy. And it's, I think, sometimes seen as like woo woo or whatever, but like our brains respond to stimulation and our senses are how we receive that information. So using aromatherapy either to soothe, invigorate, or help relax a client is I find very helpful. So those would be my like top three: heat, touch, and aromatherapy.
Yeah, and I think getting a little bit more specific into touch, counter pressure. If you're not familiar with counter pressure, there's a lot of different ways to use counter pressure. A few things are a double hip squeeze, so using your hands to squeeze hips, which kind of brings about a little bit of a distraction from where you're feeling the tension. You can do some on like the sacrum with a palm into kind of the bum area. So there's a lot of different counter pressure techniques that I would say is my go-to, and helping whoever the partner is utilize that for the person that's in labor. Another thought would just be movement. Movement is a huge pain management option. Being able to listen to your body and know that you can move and groove and kind of lean into the pain or the sensations that you're feeling can really help channel what you're feeling in that way. And I would say probably another one would be breathing. Breathing is a huge pain management resource. Often when we feel pain, we tense up and hold our breath or do like a high pitched squeal, and remembering to do low, deep moaning breaths actually helps open up and move that pain through our bodies in a really effective way.
I love that.
We could go on and on, but I think we covered a lot across the
let's
spectrum.
talk about breath, but I don't want to derail anything.
Yeah, so. I know. I'm like, there's so many things.
Well, this goes into our next question that I think is like the perfect segue is like, which of those are your go-tos? As I feel like every doula, every birth worker has their go-tos that they find really, really helpful for the people that they work with. And I think we're kind of like Mary Poppins when it comes to birth. Like you just have all these tools in your bag. And sometimes something works really well for one of our clients and it doesn't work well for another. So we're just kind of shifting kind of those spaces. I was one of those people who didn't think that I would want any like touch or counter pressure during my labor. And then my L&D nurse gave the meanest hip squeeze and saved my butt during the transition period. I was like, I didn't want anybody else, but that's what I wanted. And I was like, don't stop. And so I think there's something that like each of us has that we find, you know, like how do you go about finding that thing for your client and how do you help them identify what they might like? Do you do that prenatally or in the actual birth space once they're there?
Are we going to still just keep going in this order or do we want to reverse it, Amelia?
Let's reverse it. Why not?
Okay.
Uno reverse.
Back to Asia. Yeah, I think those are really important questions to ask prenatally when we're building that relationship. I think for a first-time parent, it can be hard to know what they're going to like. And so we present all of the options. We do a lot of practice. I do a lot of counter pressure in my prenatal appointments and saying, how does this feel? Even though you're not having a contraction, does this feel well? Are you open to this? And kind of asking that permission. And then day of, like you said, kind of utilizing, saying, let's try this out. And if it's their golden ticket, like you kind of explained, then we're going to stick with that. Or if they're like, they move through a different stage of labor and they don't like it anymore, then we pull something else out. But really good communication and asking permission around, does this work for you? And I also would say one more thing is sometimes using a combination is often that sweet spot.
I am a big nerd about the nervous system as a neuromuscular therapist. And so much like Asia, this conversation starts in prenatal appointments. And I actually start to talk to my clients a little bit about pain science, like on a very high level conversation of like, pain is your nervous system experiencing like an overwhelming amount of stimuli, right? So how do you deal with that, and understanding that context affects that? So your partner may be part of your pain management because their scent or their voice is soothing to you. So having that conversation, and then also asking them questions about like what feels good to them when they need soothing. So, and then we build like a sensory toolkit essentially to support their nervous system in feeling safe, so that any of the like strong sensations they have, even pain or what, however they want to frame it, can be managed by giving their brain as much safety input as possible. And then from there, like if they have if they are birthing with a partner, giving them a role in that as well. And so one of my very first live births, a client, when I was like, you can touch me everywhere but my feet. And so I said, great. Like if there's like a trauma around that, I don't need to know, but maybe that's a conversation you need to have with your partner, so that that isn't something that sort of like comes up for you in the very like raw and what's the word I'm looking for, visceral experience of being in labor. So yeah, I think starting that conversation early, asking them about their relationship to pain, asking them to have a conversation with their partner about any trauma they may have that they think might come up for them later, and then building a toolkit based on the senses to support them essentially, so that they yeah, like, do they want bright lights, do they want faux candlelight, that kind of thing. And then touch, and where. So yeah.
Yeah. I think I will echo all of those things. I mean, the three of us are doulas. So I want to acknowledge like some of like Lydia Carly. Is it Lydia Carly?
Yes, Lydia Carly.
Like
Thank
Lydia
you.
Carly had said, like, not everyone has the luxury of birthing with a doula or even with a partner. But if I had somebody who was laboring, let's say they were a multip, they have had children before and they were laboring very quickly, and I had to run out of the house as quickly as possible, I would default to like just the sensory things. So I would grab lavender and clary sage. I would grab a fan, a portable like fan, just to kind of manage like I can keep you warm with my body, but it's really hard to cool you off. So I would have a fan on hand, and then even my clients that say they don't like you to touch them or be in their physical space or something, I will say I have found a lot of times those feelings change in the middle of the labor, and often they don't want anyone to touch them, Amelia, like you said, except for maybe someone who knows how to feel their energy, talk to them, the baby, talk to their body in that way. But like if I had to do like one thing, it's that double hip squeeze. And in fact, I sometimes have to hold it back until they're a little bit more advanced into active labor, because that's very hard to do for 24 hours. And once you introduce the double hip squeeze, you want it every time on every contraction.
There's no taking it back.
There's no taking it back until I will say like the sacral reflex is activated, because the baby's kind of through that part of the pelvis. So I don't know, essential oils, fan, physical touch with a double hip squeeze.
Yeah, I love that so much. Yeah, I think it is one of those things where utilizing your own as a doula, I think looking at, what is the tools that are needed in this moment, and like when are they, this is one of the like many skills of the doula, is knowing when to pull what out of your bag. So let's chat a little bit about the greatest differences and benefits between choosing a non-medical option versus a medical option for pain relief in labor. And I'm going to popcorn to Asia again. We'll keep going backwards.
Yeah, I would say, coming from an understanding of a physiological birth, movement, the ability to move your body is, I would say, the greatest benefit of utilizing non-medical pain management options. I don't want to get too much in the details, but yeah, with an epidural, you're often confined to the bed and there's limited movement. And so being able to utilize your body in a lot of different positions really makes the flow of labor often much, much better for the birthing person.
Gosh, I'm not even sure where to start. I would say that along with movement, I'm going to say I'm going to go back to the sort of the beginning of our conversation where Heidi mentioned hydrotherapy. So like you know, we hear a lot of stories about water birth, but like a shower is its own like sort of like saving grace in those moments. It gives, I think, time for, in addition to movement, because you're going potentially from the hospital bed to standing or to a shower stool or what have you. So you're walking and there's that movement, but also I think it's soothing. And in those moments with the contractions, sometimes that's what a client needs to get through that sort of like earlier labor, right? So like where it's like that having the doubt of like whether or not they can keep going, having that option, I think helps with the psychological resilience that's needed to move through the stages and getting to, you know, the pushing phase.
Yeah. And then just to close that question out for you, Amelia, I'm going to give a statistic that people find mind-blowing. Lydia, Carly, and Asia will probably be like, yeah, okay. So this is my 20th year. I've supported almost 1,500 births. And my cesarean section, I'm like, when I say my cesarean section rate, like I'm not a doctor, so I don't do cesarean sections, but my clients that have a cesarean section, it is still 0% if they go into spontaneous labor and no medical interventions are used. I have never, ever, ever had a client end up in the operating room. I'm not going to say that that's not going to happen today when someone goes into labor, but to have almost completed 1,500 births over 20 years and never walked into an operating room when I'm exclusively a hospital-based doula, intervention or pain relief and non, is I just can't downplay the cascade of interventions. Do I have clients that get medical interventions, and these are amazing tools like an epidural, and sometimes they help them to have a non-traumatic birthing experience that leads to a vaginal birth. But the biggest holdup for me is that the second we start adding things, I know we're turning a corner where our risk of cesarean is just going up as we start adding interventions. And when people hire you and they say, I don't want to go in the operating room, you know, we have to be realistic about that conversation and setting up their expectations when they choose medical options for pain relief.
Yeah, for sure. And I think acknowledging, you know, where everyone is and what their needs are and addressing some of those needs prenatally can really help impact the resilience that we have towards the sensation of pain just in general. Sometimes there's risk mitigation, right? If there's, you know, people are like, I just had this mental block and whatever, addressing those things prenatally before they get there can make huge impacts when it comes to the decisions that they make. And I think, you know, practicing around, you know, prenatally what you're going to do, making a plan for next steps, what you're going to try, even if you are determined that, you know, at this point in my labor, I do want to opt for an epidural or I do want to opt for XYZ intervention. Having a plan to get you as far along in your labor before you do add that intervention does also mitigate risks as well. So kind of like having those conversations, I think, are really, really important to address. Here's what your goal is, and here's how we can get you there, from as much as I can do humanly possible, right? And then your decisions and how your plan kind of like fits into that is really, really important. So what support, advice, and encouragement can you as a doula do you as a doula provide prenatal leave for those who are wanting to push towards an unmedicated birth? They're wanting to opt out of medical intervention as much as possible. They're wanting to kind of reduce some of those risks. What encouragement do you have them kind of like lean into prenatally to help them achieve that goal? I'll ping to Heidi on that one.
Okay. Shameless pitch. I have an online course called Birth Story Academy, but in that course, there's an entire module on this topic. And we do like a birth visioning workshop. But what I would say is I'm a trauma survivor. I am a trauma-informed birth doula. And I would say a lot of clients have a fear of the hospital or a fear of the OR. And that's why they're leaning towards hiring a doula. Like something has happened in their life that's made them skeptical of the medical community. But they also want to maybe birth still in a hospital just in case. Whether you're in a hospital, you're in a birth center, or you are birthing at home, I think it is really important to check in with yourself, your therapist, your family, and identify what your past traumas are, what your body is holding on to, what your womb, your ovaries, your stomach, your heart, like what are we holding on to? Because I have seen labor get transition specifically when we're leaving our bodies. Like everyone has a different philosophy. I believe that's when we leave our body and we find our baby's soul and we come back together and we birth to the earth side. It is the transformation of both the birthing person and the child and anyone really who's in that room. But if we haven't done the hard work in advance to heal those traumas, I have seen them come out. And when they come out, it comes out as fear, as blockage, as a stuckness or stall in the labor. And it has wrecked someone's beautiful capability and potential to birth naturally and unmedicated. But I just wanted to, we just can't downplay the emotions of primal mammalian birthing. In order to set yourself free and let go, you have 9 months to do some of that hard emotional work.
I don't know how to follow that. But let's see. I think what I will take from that and add to is having the conversations. So like one of the things that I talk to my clients about is that the reason why we have these prenatal planning sessions is because I don't want you to be in your birth room, in your birth environment, and making a decision then about something you have not had the time to deeply discuss, deeply reflect on, and make some sort of preliminary decision about, knowing that that could change. Because your birth plan, I always tell my clients, their birth plan is a moving target. We have an overarching goal, but that doesn't mean that it is going to go exactly as we would like it to go, because the person in charge is your baby. We are on their time, their schedule, right? So, and so we start to have conversations about like, let's talk about what your fears are around surgical birth. Let's talk about what your fears are around birth in general. And then let's also talk about, like what you want your birth to look like and how you want to be supported. How do you want your voice centered? Some of my clients are like, yeah, let's create this plan. And then what's helpful for them is that like their partner is in charge of making sure that every time shift changes, someone has that birth plan in their hand, right? Like that's their role or what have you. I think that having those conversations before they need to be had makes it easier to navigate it in the moment and not feel overwhelmed or with fear or anxiety. And that can affect how labor progresses, like Heidi is saying. So yeah, I think let's have the uncomfortable conversations now so that later it's easier to make a decision when a decision has to be made. So on the birth plan that I create, there's like you know, first stage, second stage, newborn care, and then there's a column for in the event of surgical birth. And then so we talk about all of those things, even if it never happens, so that they can sort of like release that anxiety of like, we have a plan if it gets to that, but we don't have to really care about that or focus on that going into labor and delivery.
Well said.
Thank you. Yeah. When I think of what advice to give someone if they are preparing for an unmedicated birth, I think the big question is helping them understand what their why is, why they want that, why it's important to them, and really channeling how to move through the fear. We've talked a lot about that, but fear comes up, and making sure that they know that they have the information, the support. I think understanding their why and then having a support team that is also aware of their why, whether it's their doula, their partner, their OB, their midwife, the nurses, whoever that might be, is saying, this is my why, and I need all of you to back me in this, because day of, sometimes you might forget what your why is. Sometimes that fear comes in, and having someone to look you in the eyes and to hold your hand and say, remember why you wanted this. Remember why and what you're capable of. We're all here to support you, can really help transcend some of that fear and anxiety and the overall feelings that come day of. And so I think that's really, really important. And I can't stress the support team, because there are so many things that change. And I don't want to get too much into the anecdotal, but right, like we've all had clients where their water broke at 36 weeks, or something happens where they have to go in, and they still, that why of having an unmedicated birth is there, and making sure that the support team is there to say, I know a few things have changed, but you can still do this. Let's go here. Like, we're here to support you every step of the way, can make a huge difference.
Yeah, for sure. I think echoing all of that, especially leaning into what Lydia Carly was talking about, of like identifying, those fears that you may have, like your worst case scenario, because a lot of times the worst case scenarios are such rare instances, and we can put data behind the worst case scenario. For example, having a client who is like, my worst case scenario is having a cesarean under general anesthesia, and I don't remember anything for hours after birth, and I don't get that initial like golden hour with my baby. So has that happened to you before? If you're a multi-mom, it might have happened before. And that may be why that fear is there, is they've already walked down that road and had that experience, and they don't want to experience that again. So they're looking for reassurance that that's not going to happen to them again. Other people, we hear from everyone else around us our worst case scenario stories, right? Like as soon as you're pregnant and people start noticing that you have a belly, and they're like, let me tell you my worst case scenario story. And so empowering them to turn around and say, this isn't working for me, for you to tell me this story. I need you to hold back on this, because I'm trying to surround myself with positive birth stories. Shameless plug for Heidi's Birth Story podcast and other spaces where you can go and hear those safe, empowering birth stories that help you. This is your goal that you're working towards, hearing other people's stories. And I think the power of story for the people that are around us that are telling us, like, this was my story and I did XYZ and it worked really well. This is how I got through birth unmedicated, and kind of infiltrating and seeping your life with all of those stories. I would love to hear a little bit kind of about like the power of story, and the power of story of how you've seen that. This is a little bit of a curveball because it's taking one of our questions and kind of turning it around. But of the stories that you hear, where do you find and recommend that people find stories of empowering births? And is there anything that you tell clients about when it comes to, how do you surround yourself with those positive things? What do you say to somebody if they're telling you like their worst traumatic birth story? And how do you kind of mitigate that, because we can internalize those fears of other people's experiences? I'll pop to Heidi on this one. We'll start with Heidi.
Sure. Well, I do think the podcast space is really beautiful. And also people are having all different types of birth. So if someone's planning a home birth, like I love listening to the home birth, like doing it at home is one of my favorite, or the Happy Home Birth podcast. If you're planning to have a vaginal birth after a cesarean, like I love the VBAC link. Like there is no shortage for amazing birth podcasts. So just typing in pregnancy podcast or the birth hour, I think they have almost 800 episodes on the birth hour. So they're just, I think it's a really easy way, especially when we're asking clients to maybe spend some time alone, going for a walk or taking a bath, to like put their AirPods in and just listen to, and this is free content. So listening to positive birth stories and surrounding yourself in that way. So there's two other speakers, so I'm just gonna go on the podcast one. I think that's a great place for free information.
I would, I'm so glad that Heidi's mentioned all of those, but I also wanted to like pull a string of something you said, Amelia, about if they've had a traumatic birth story. And so I think what's really important is listening to that story first, giving them the space to tell it to you, and I always tell my clients that my first postpartum session with them is just to listen to their birth story. Like it's like a debrief, because I care about them, but I have no emotional like investment, real estate in what happened to them, or in the way that like a mother, sister, cousin, lover would. So like I can hold space with them for in a way that they don't feel like they have to filter themselves. So listening to their story, especially if I am with someone who's already had like their second time parent, like listening to the first story and hearing the things that they're hoping to heal for themselves moving into the story they're creating with their next birth. So I think that is definitely one of the things in terms of stories. And then I think empowering or encouraging them rather to ask the story of their own birth, to know the story of maybe their mother's birth, to sort of like go back is also, I think, something that can be helpful to see how autonomy was present or wasn't present. I think is a big deal for a lot of pregnant parents, like knowing what is different from generation to generation. And it may not be positive, but it will give them context for a lot of things that I could get into, like how their parents parented, how their grandparents parented, etc., that like might show up for them as like things that they are concerned or hold fear about, moving into their own story of being a parent and birthing. And then I think also stories, cultural stories of birth. Like if they have a strong cultural heritage, what are the positive birth stories that are part of their culture, that aren't necessarily part of hospital birthing, but it doesn't mean that energy or story can't be part of their story regardless of the environment that they choose to birth in.
I think Heidi and Lydia Carly really summed it up. I would just add that, I think being aware that birth is really individual and that there's some stories that would empower one person and traumatize another. But there's some stories where like that is their dream birth and someone else would be like, that is not how I want it to go. So really making sure that these people know themselves, know their, as we've talked about again, know their triggers, know their traumas, know the things that empower them, because a 5-hour precipitous birth might be an awesome and empowering birth story for someone, and another is like, nope, I'd love it slow and steady, right? And hearing kind of what that would look like. So knowing what is important to you and then utilizing thank goodness for the internet and social media, because there are so many resources out there. We didn't even talk about books, but there's a lot of books out there where you can read stories of people, writing down their birth stories. And that's something also that I encourage my clients to do, is to write out their ideal birth story, and creating their own before it even happens can be really helpful as well.
I feel like these are all little like therapy tidbits that doulas are offering to their clients, which I love. And I think that,
yeah. Oh, go ahead. Can
go
I
ahead.
back off on that though?
Yeah.
And I'm not a therapist, okay, but a therapist taught me this exercise. And so if there's anyone listening that is what we would call multip, that has, like Lydia Carly had mentioned, like has had a previous birth experience, right? I do an exercise with my clients called completing the birth. So we go back to the moment where it went this way. So if they were laboring, or maybe they got diagnosed with gestational hypertension or something, but wherever the diversion or the trauma occurred where they can isolate it, there's a lot of tears that are shed in these sessions. But if they ended up in the OR, I walk them through a vaginal birth, and we walk through birthing vaginally their child, or walking through, like, this person made me feel this way. And so we just rewrite the story. Again, not a therapist. I had a therapist train, but I will say that I've had a lot of people like lay on my couch preparing for their birth spaces, and I just call it a completion of the birth. And I ask individuals, is this something that feels safe for you? Would you like to go back and enjoy the opportunity to envision that it could have ended a different way? So
Definitely. And I think pinging off of that as well is just the conversation of like, what are the conversations that have surrounded you your entire life around birth? Like, what are the first things that you encountered about how birth happened? Because if your mother had a particularly traumatic birth, or your grandmother had a particularly traumatic birth, and they're sharing those stories with you from a young age, or they're saying like, when I birthed you, it was the most horrible thing. I've heard you hear the crazy things like,
Or what do you
parents
see
say
in
this.
movies, right? Like, what do
Yeah.
you see in movies?
Right.
Women being rushed into the hospital.
Yeah.
That's often what warps or perceived, gives someone a perception of birth.
Yeah,
Yeah.
the emergency, like, OMG, your water just broke, and it's 2 minutes later, your baby, and everyone's screaming and frantically running around. Those stories like impact how we view birth. And so I think a lot of that has to be reprogrammed as well. And just the whole conversation shifted in order for them to kind of like step into their dream birth space, right? And be able to like write their preferences that fits them. Yeah.
Can I add one more thing?
Yeah.
I'm sure I'm not the only one to tell a client this, but we don't talk about sex, so we don't talk about birth. So starting with that, like that sort of conversation, like what was your relationship to the conversation around reproduction? And if there is no conversation about that, then the conversation around birth is its own sort of like emotional field of landmines, like that you like don't know how to navigate, because the thing that's intrinsically linked to that, like reproduction, regardless of gender or sexual identity, is not something that you're even familiar with or feel comfortable with. So how are you going to have this conversation about birth without fear if you're not talking about how you got there?
Yeah.
Yeah.
We don't talk about birth control, and we don't talk about birth in our culture. So we have to like start those conversations during your prenatal care, which is less than ideal. Preferably, I would like to have those conversations 10 years prior, but we're working from where we are today. So let's also, like, I think this is a perfect kind of like segue into talking about pain versus suffering, or the sensations of pain versus suffering. And I'm going to ping back to Asia on this one to start. I would love to hear your personal perspective and how you chat through clients about the sensations of pain versus I'm actively suffering.
Yeah. One kind of conversation that I would say that I have is, in any other circumstance, most of the time when we experience pain in our body, it triggers our brain that there's a problem and that we need to fix it, and that it's bad. And I feel like birth is that one time when we feel that pain or that sensation, and it's progress, and it's actually a sign that things are moving in the right direction and that there's a purpose there. And so that would say, I want to save some of it for the others, but I would say that's a big conversation that I have, is when they are feeling these sensations, the pain that that their body is showing them is that your body is moving in the right direction, that this is what is needed in order for your body to open up, for your baby to come down. And if we're able to remind them of that during labor, it can often slow down the anxiety or the brain trigger that I'm suffering and I need to be saved, or there is a problem and we need to stop it right now. So that would probably be what I initially start the conversation with, and I'll let the others fill in and add some to that as well.
I would say that if pain is like one of the things that they are absolutely afraid of, and like in terms of pain versus suffering, is knowing that like even though contractions aren't like perfectly patterned, that it's a pattern. Like it is not a steady amount of pain. It is not like when you cut your finger and like the pain is just there, right? Like it, because you're waiting for your body to figure out that like there's been a breach to your protective layer, versus with contractions, like there's an ebb and flow to them. And so giving them that sort of context again for the pain, that like it is purposeful, it is not persistent, and like it has a progress to it. I think suffering is a perpetual state of like, nothing is helping, nothing is changing, breath isn't helping, temperature changes aren't helping, like nothing is giving you a sense of relief or like hope that something is going to shift. And so I think giving that context, like I said before, like pain is dependent on context, is I think is helpful to them. And then that also gives them vocabulary for when and if they do feel like something is wrong, to be able to voice and say like nothing is helping, I really do need help. And then as their doula, showing up to be like, hey, something needs to happen here, or something needs to change.
Beautifully said. In my experience, Amelia, what I have seen the biggest amount of suffering look like is exhaustion. So almost like mental pain, like they're so tired, like Lydia Carly said, it's like all the tools in the toolkit, even the hip squeezes aren't working anymore, the breath work isn't working anymore, the aqua therapy isn't working anymore, because we're so exhausted. Now that could just be physiological birthing. They were in prodromal labor for 3 days. They had a 5-year-old and a 3-year-old at home. They're carrying twins. They're coming in with, and they haven't slept going into the labor. They're not properly nourished or hydrated. But I do see exhaustion be the culprit, I think, for the majority of the pain that I see. And so for all of you that are listening, if you can prioritize rest, and some people can't, some people we have to work until we go into labor and we have multiple kids at home, but if you can prioritize rest before going into your birthing time, or prioritize rest in that ebb and flow and in those down times, I think that you will be able to use more of the tools that we've outlined today for a longer period of time.
Yeah.
But, oh, I forgot to say, but I simply just ask. I will kind of cradle them, like more grandmothering energy. And I will simply ask, like, are you in pain? Like you just need to be energized or try something new, or do you feel as if you're suffering? And most birthing persons are pretty honest, like, no, I can keep going, just help. Or they'll just melt into you, like, I'm so done here. Yeah.
It's exhausting when a baby's malpositioned, or there's extenuating circumstances right in those births. It's like things aren't progressing the way that we want to see them progress. Like we ideally want to see somebody continuously changing kind of their vocalization of the tones and their demeanor, from happy, excited of my baby's coming, to very serious, and kind of like marching forward towards transition and pushing, right? We want to see those changes. And I think that this is where conveying flexibility and birth plans and helping folks determine, what is there a point in your birth plan that something might change, and what would that look like for you? And even if it's not necessarily written down, I would love to hear your thoughts on conveying flexibility in birth plans. How do you go about doing that? For example, being very determined going into birth that you are going to have an unmedicated birth, but then things have perhaps changed, or prodromal labor has just exhausted them for 4 days, and they're just not able to progress because they're not able to rest. What does that look like for you as you counsel them and support them through that shift in their birth plan? And I'll start with Heidi on this one.
Sure. So first things first, I had a medicated birth and then I had an unmedicated birth. So I try to bring that perspective of that long, it's 43 weeks gestation, 50-hour long labor, the doula who is never going to have a epidural and then is like getting her epidural, and then the second ones that just kind of are perfectly positioned and go fast and birthing unmedicated. So going back to positive birth stories, I try to share these stories with my clients, like birthing person to birthing person, like the reality of that flexibility, and knowing that they're birthing with someone who's safe, who also had to be flexible. That, I think, solidarity in a lot of birth situations can make you feel good. That being said, when a client comes to me and they kind of say, like, I think I want to have an unmedicated birth, but like I'm just maybe have a wait and see attitude. Like, I have a very realistic conversation with them that like, in my experience, there's just really no such thing. If that's your attitude going into your birth, you're only going to have an unmedicated birth if it goes very quickly and they're like, wasn't time. So I try to lay the foundation of flexibility, but I try to also be a coach and be stern and be realistic that an unmedicated birth is something that you must train for, from all the things we've talked about, from trauma-informed birthing, fears, body work, just so much. But like, if you sit down in my prenatal and talk about a wait and see attitude, I'm like, let's just plan for your epidural, or we spend a couple hours really working through, do they really want an unmedicated birth, but there's some fears blocking them, and we just need to do a little bit more fear work.
I would say, in terms of flexibility, that's kind of one of the cornerstones, no pun intended, because of the training that I did, but of the conversation, so that they can get to where they're going, knowing that there's multiple options of how to get there. So and I don't know if this is, because I had a client who was kind of like, well, if I want nitrous oxide, is that still? And I'm like, listen, if you want nitrous oxide, you can have it. If that is what, because it is not, to explain further, I think what happens is people feel like, I have heard clients sort of, and this might be not having enough information, it's either unmedicated physiological birth, epidural, or C-section, not understanding that there's like a range of things from unmedicated physiological birth to epidural. And so they're like, what do you mean? And I'm like, well, let's have the conversation, because I think knowing that there is a range of ways to get through their physiological birth helps them to realize that it's not all or nothing. Because I really think they feel like it's like either this foot is on the gas or it's not. And it's kind of like you're cruising and then you're deciding when to take a turn, when to stop, kind of thing. So I think knowing that there are options that are not as medically invasive that can support them to their ultimate goal. I feel like nitrous oxide is one of those options that is not always highlighted. Like when a client goes to the hospital to register or to speak with or to an appointment, they're kind of like, oh, I don't know if my hospital has that, but we talked about the epidural rate or access, and I'm like, okay, but also there's this other option. So I think in terms of flexibility is making sure they know what their options are. What does your hospital offer? What does your birthing center offer? What does your home midwife offer to help you? That is not like, what are all your options before epidural? And if you know what all those options are before epidural and or C-section, how would you like to use those? Once you have a good understanding of what those options are, how they benefit you, what the risks are, etc., so on and so forth. So I think, and then also to add there, knowing that there's a psychological resilience that is needed to get through an unmedicated physiological birth. So in addition to rest is hydration and caloric intake. I have, from the moment I became a body worker and was sort of understanding that like physical preparation for prenatal or for pregnancy is not something that is centered at all. I was like, I don't understand. If you're running a marathon, you have a strength and conditioning coach, you have a athletic psychologist, excuse me, you probably have a chiropractor, you have you have a list of people who are on your support team, and they center you, right? Why don't we do that for pregnant people? So in the preparation for going through an unmedicated physiological birth, I think we need to be having a conversation of preparation. So do you feel physically prepared to go through this marathon? Do you feel mentally prepared? Do you feel emotionally prepared? And then coaching based on that. And then also being like, I don't have that resource as your doula, but this is a person who could help you. Or can you ask your insurance company if they cover X, Y, or Z for support? Because birth, labor, and delivery is a marathon. And it's a marathon that you don't know the length of, right? Like, the 26.2 for a marathon, but you don't know if you're running a century when your water breaks. You have no idea how long you're going to be in it. So having as many tools and having as much preparation to run this marathon well equipped is I think part of giving them flexibility and options and preparedness to go with the flow of how things might or might not go.
I have a pretty frank conversation with most of my clients around flexibility. I think in most cases, if you are giving birth in the United States, an epidural is on the table. And most clients know that even if they're doing a home birth or a birthing center, they know in the back of their head that there could be a transfer. They know if they're wanting to do a completely unmedicated birth at the hospital, that they can say the words, I want an epidural. And most of the time it's an option, right? And so I have that really frank conversation with them and saying, you've expressed that you would like to avoid an epidural at all costs. Why, right? Going back to the why, tell me let's talk about the flexibility of if you are in labor, as Heidi said, for 50 hours and you haven't slept and you're at this point, would you be open to an epidural? Are you still absolutely not, don't let me have it, right? And because we build these relationships with our clients, we know their personality, we know their approach. And so really helping them say, let's talk about flexibility. Let's talk about scenarios where an epidural might be helpful for you, right? I'm not anti-epidural, but if you also have completely sworn it off, let's talk about what's in between, as Lydia Carly has said, and I think also being really realistic of, I've had a client that said, I know I want an epidural, and then guess what? It wasn't possible and it didn't happen. So having that really transparent conversation of, I know an epidural is on your birth plan, but what if they don't get to you? Or what if that isn't an option? Let's introduce all of these, pain management options that don't include an epidural, and making sure that those clients are just as well informed and educated and prepared, because we've seen every scenario in the book. So the flexibility has to be there for every client, regardless of what their birth plan is initially. And then making sure that we are supporting them with love when that flexibility is needed, I think is so, so important, because we don't need any shame, any guilt, or more fear from a doula or from the support team when that flexibility is really needed during the birth.
Yeah. I think those are all just such incredible points, and I would echo every single one of them. And I think that when we're looking at flexibility with a birth plan, like you said, Asia, there are the instances where the epidural, they get it placed and it just doesn't work, or it works on one side, it doesn't work as expected. And so having just this full range of conversation of like, what if XYZ happens? Here's the other tools that we can kind of utilize. And I think also starting the conversation of, we don't have to go straight to the big guns. Like, we can start with the TENS unit and see if that helps you. Or, if you've been sitting on that yoga ball for a while and you're starting to feel the sensations, like changing what you're doing right now, maybe go get in the shower or in a tub, or kind of just moving through, maybe try a different position if this is just getting really intense. Like, maybe we move to like doing some cat cows for a little bit and see how many further, because sometimes that sensation of I can't do this fades. And sometimes like it just gives you, okay, I definitely know I want this now. It just gives you a little bit of time. And so kind of like having that flexibility built into your birth plan and into the conversation prenatally, as well as like in the birth space, is really helpful. So I'm going to open it up for Q&A. If anybody has any questions, I would love to invite you to pop them in the meeting chat. I saw that Sierra added a really great point that I'm actually going to read just for everyone. Sierra said, definitely giving myself the mental, this is what I want and what I'm planning for, but if I want something else, this is how that will go, / these are my options. Definitely made me feel better through birth and made it less stressful to have an unmedicated birth. Giving myself grace made all the difference for me personally. And I think, yes, I would echo that. Also, feel free to raise your hand. If it's okay if nobody has any questions, I'm just going to popcorn back to Heidi and listen to any last thoughts that you might have.
There's a question that was sent to me, or I don't know if it was sent to
perfect.
all. But
I think it might have just been to you. Do you want to read it for us?
Sure. Does some insurance accept doulas? And I can answer what I know, and then I'll go from there. Yes and no. I think that's changing a lot. Actually, this year, I've seen quite a few states start to have Medicare be cover doulas. So I know in California that's happening. I feel like Tennessee is another place. Don't hold me to that.
There's
but
6,
yeah, there's a few different states that are now covering doulas under like state insurance. And then I also know that TRICARE, which is insurance for military families, is also starting to cover doulas under the insurance. And then I'm trying to see if there's anyone else that I can think of. But I also know that being listed as a doula for these services is its own process as well, if there are doulas who are listening. So yeah.
I'm going to add on that, Lydia. I just went to a doula summit for like our area health education, and it was a panel of the like 7 different states where Medicaid was accepted and what that looks like. And we believe that Medicaid coverage is coming to North Carolina, which we believe then commercial insurance will follow Medicare and Medicaid as they usually do. Right now, it's a lot employer-based in my area. So AT&T is a union. They cover doula services in full in excess of $3,000 per birth. So AT&T is a great, like, I'm talking to the doulas up here, but AT&T is a really great company to target for birth doula services. But each person that's on this call, like, no one has a small voice. It all starts with your employer and your employer HR. Anyone can send an email saying, here are the benefits of doula services. Here are the statistics of birthing persons in our country. Would you consider adding doula services to our, this makes a statement. So like in Charlotte, North Carolina, our big employers are Bank of America and Wells Fargo. And I'm fighting and advocating really hard for benefits to pop up within these two giant banking organizations, right? So it literally, I think, just starts with insurances. One person that works at one company having a conversation with HR to say, when you're talking to Cigna, could we add this benefit? The insurance companies like AT&T and United Healthcare. So that means United Healthcare has the benefit. It's whether or not the employer chooses it. So let's keep putting pressure on our employers to provide birth worker support and doula support.
Yeah, a lot of corporations that also, some bigger ones, Amazon, a lot of the big unicorns in the Bay Area cover doula support, Walmart. So definitely look into employer benefits. And a lot of times you can also get reimbursement under your HSA or FSA, which is tax-free dollars. So definitely be aware of that as well, if that's an option available for you. In the comments, I listed all the states that currently have Medicare support for doulas. There's 6 currently. The goal is all 50, right? But Oregon, Minnesota, New Jersey, Florida, Maryland, and Virginia all cover. And that list, I'm sure, is going to be expanding in the near future. That's been a rapidly expanding list. I think Virginia is the newest. So yeah,
California should be on that list, no?
California as well.
California, yes, too. I don't know why that's not on there, but okay, yes. So this might be a little bit outdated. Also, Misha asked, how do I train myself mentally for managing pain? I'm scared of the pain part. And I'm going to ping this one to Asia to start.
Oh, thank you. I think we tried to cover a lot of that, but I think a lot of mental work with, if you have a therapist, if you have a counselor that you can meet with and talk through why pain scares you, what aspects or what history you have in your own personal life around pain, what that represents for you, and then being really open and transparent with your birth support team and saying, I'm scared of the pain. Let's do some practices and exercises around that. I think would be a really great start to identifying that, and start as early as you can. Even if you aren't pregnant, start to work through that. Or if you are, jump in that right now, because you're totally capable of managing the pain of labor. We just want to support you with all the resources in doing that.
I would add, if you're someone, in addition to like having somebody to talk to, if you're someone that journals or is receptive to meditation, I think that guided meditations are very helpful. I think that because you can start to create sort of like your mental safe space before you are in labor. So Spotify and Amazon Music have some hypnobirthing playlists that can like lead you into meditative states around the sensations of labor and delivery. And knowing that it is going to be a high sensation experience, but doesn't necessarily have to hold the context of pain. So yeah, those are potentially free resources if you don't have access to a therapist.
Yeah. And just full disclosure, Misha is my private doula client. So Misha, we will talk clearly more as the conversation's gone, but to speak to, I'm going to answer the question, speaking to everyone, just building off of what Asia and Lydia Carly said, is practice being comfortable in your body. Get naked, get in front of the mirror, touch your body, breathe with your body, listen to what comes up for you. When you are fully naked and hands on your heart, and you are trying breath work with like a guided meditation, what is coming up for you? Like, what's making tears in your eyes? What's holding you back? And let's focus on that in therapy, with your doula, with your partners, with whoever is your intended person or persons are that are going to support you in that birth space. Like, you can do that privately. And then, like Lydia Carly said, journal about that and get get really clear on those just positive self-talk, of how strong you are.
Yeah. I've also seen one trend that I've seen go around as well. I loved the Gentle Birth app for guided meditations and just like learning to like kind of go back out of the present into just kind of, your elephant brain, if you will, like that like piece of you that is mammalian, I guess you could say, of just like this, you're human, you're in this moment, but like you are not the sensation. The sensation is kind of an outward force, but it's also part of you, right? So you are the passageway for the passenger to pass through into, the world around you. You can also practice with like small amounts of discomfort. I've heard people like practicing with ice cubes to practice like, like holding it until it's completely melted. Just that like getting comfortable with discomfort. I think we in our society are very used to everything being just like really comfortable. And I'm totally here for that. I'm like, get that self-care on, get those massages, get that comfort. But sometimes we have to walk through pain in order to get to the desired goal that we're going to. But also remember, this pain, the sensation, this discomfort is not going to last forever. I found it really helpful to kind of like do math. This is totally silly, but how many contractions am I having every hour? And if I can get through that many contractions, and I would just count them down and be very methodical, I would tap a lot. I would turn on the meditation tracks, and then I would try and sleep between the two. So yes, I think, let's see. I'm going to add into this, yes, in the comments, a really wonderful post from Sierra. Again, definitely go read that. And Heidi, I am going to let you go ahead and tell Jagger's story. I think that's great.
Okay. Is that closing this out, Amelia?
Yes. And then I would love to have you tell people also where they can find you and connect with you online.
Okay. I'll let everybody do that.
Perfect.
I just wanted to say thank you so much for inviting each of us to be on this panel today. Anja and the CEO, Catherine Cross, and Amelia, who's the head of community, they're very near and dear to my business. Anja is a cord blood tissue and placenta banking company. They do a plethora of things. You can learn more about Anja at anjahealth.com if you don't know all about Anja. But I wanted to just quickly tell my story without scaring any of you guys. Birth is unpredictable, and my child had a birth injury. He has cerebral palsy. He had a stroke during his labor. This is not going to happen to you. This is my story. Every child is different. But I will never forget being in my prenatal appointment and my doctor handing me a brochure and saying, "Have you considered cord blood banking?" And I was like, "No." And I threw it in the trash can. I was like, $60 a month, didn't even consider it. When my child was 2 years old and he couldn't walk, he couldn't talk, and he barely walked, and his arm and his leg were turned in, and we were getting a diagnosis of cerebral palsy and seeing the brain bleed on his brain. The first question I was asked in the neurology office was, "Did you bank his cord blood?" And I just started bawling. I'll get so emotional, you guys, because I was so terrified that the answer was no. I thought I was invincible, and I thought birth was invincible, and my child was invincible, and that I would never have a child with leukemia or a stroke or an illness or an injury in which the very thing that I built inside of me, that nourished them, that stays still in the cord after it stops pulsing, there's still cord blood there that is rich with healing. And so we were left with no options other than physical therapy, occupational therapy, and speech therapy, which I'm here to tell you were way more expensive than cord blood and tissue banking. So I am beyond grateful for Anja and companies like Anja, because if I can just help one family, just one, I just need one story where they chose cord blood and tissue banking, and their 4-year-old was diagnosed with leukemia and they had support. And I'll know that Jagger's story is making an impact on this world. So I just wanted to make sure I came in and gave your company so much thanks. It's having a conversation about cord blood and tissue banking is primary to our prenatal meetings every time.
Thank you so much, Heidi. I appreciate your story and love holding space for you. And we're so grateful that you're part of our community and that we can be part of this panel together. I think that just these conversations and the normalization of everything that we're talking about, it makes a huge impact in the families that we're serving. So Heidi, where can people connect with you online and find more about your work?
Birthstory.com or on Instagram, birth.story.academy.
Alrighty, do you want to go, Lydia Carly, and tell us a little bit more about where we can connect with you?
Sure. My birth practice is called Sage Femme Wellness, and that is based on the French word for midwife / femme. Also, I'm of Haitian descent, and so in Haitian Creole, it's femme sage, and so I honor my heritage and my grandmother essentially being my mother's birth person. She did a lot of like postpartum, similar to what a postpartum doula would do for my mother, and so a lot of that is where my my why comes from in this work, is holding that space for those who don't live in multi-generational households or don't have that network of support. So on Instagram and Facebook, it is Sage Femme Wellness. And my website is sagefemmewell.com. And I would love to connect with anyone who has questions. Like I tell my massage therapy clients, I can't be everyone's doula, but I want you to have the information that you need. So if you have questions, please reach out and I will do my best to share information.
Thank you so much. All right, Asia.
Yeah, thank you so much for joining us all today. I hope that you all benefited from our conversation. You can find me on Instagram, The Birth Partner, and then my website is asiathebirthpartner.com, and I'll drop that in the comments, and maybe all of us should. But yeah, reach out to us. We'd love to continue this conversation and be a resource. The birth community is a really supportive community, and so we have a lot of resources and are connected all over the country depending on where you are. So don't hesitate to reach out if you have any questions at all. Thank you.
Yeah, beautiful. Thank you so much for taking the time. Yes, please type and share where people can connect with you online in the comments so that people can grab a screenshot of that if they'd like. And also would love to see you all in our Better Birth by Anja community. That's community.anjahealth.com. We're just creating space where families who have questions or need support through your whole perinatal journey can get the answers and support. And you can find out more about more events like this, doula panels, ongoing conversations. We're super excited to launch our Better Birth speaker series, this is the very first panel group for that particular series. And so we're going to be saving all of these conversations. So if you miss one live, there'll be recordings. And if you want to share this with somebody that's in your life, or if you're a doula in the chat or in the participants who wants to share this with your clients, we would be honored to have that. So I'll be sending out replays of this, but I really appreciate you all taking your time, your hour and 15 minutes out of the middle of your day to join us. And I appreciate all of you. So I hope you have a beautiful rest of your day, and we'll see you around.